What is susceptibility bias? Susceptibility, it is a type of selection bias. So let me give you one example. Let's suppose you are conducting one study. You took 100 patients with chronic coronary syndrome. You divided those 100 patients into 50 and 50, right, into two arms. So 50 patients you assigned to one arm had more risk factors, more severe disease than 50 patients you assigned to other arm. So let's suppose in that arm had multiple risk factors like diabetes, hypertension, smoking, other comorbidities, chronic kidney disease, but another 50 patients were more healthier. So in healthier patients you subjected them to stenting, but in sicker patients you assigned them medical therapy, conservative therapy, and you are now studying whether stenting is improves outcomes or medical therapy improves outcome, and your result show that stenting improves outcome. So what is the problem in this study? The patients whom you assigned stenting had less risk factors, were healthier, so definitely they will survive better, they will have better outcome. But patients who had multiple risk factors, who were sicker, you assigned them medical therapy, so definitely the mortality in those group will be higher. So this creates a bias in the study. This is a type of selection bias, because the problem is in the selection of study subjects. You have assigned subjects differently to these two arms, so the problem is in the selection of subjects. So this is also called selection bias, and better term is susceptibility bias, because those patients who were sicker were more susceptible to death, they are more susceptible to mortality.